I will just do a short oral health talk. Okay? I will just tell you briefly about the mouth and the teeth and how we should take care of that. Why the mouth? The mouth is a very important part of the body. The mouth is the gateway to your body. It's a gateway to your body, like that gate. So that gate is very important for this home. If you don't have a gate, you will not feel safe. Yeah? Even at night. Even when we came, after we finished everything, I think it's Lost who said, can we now close the gate so that we can feel safe? So that means the gate, the entrance, the gateway to the body should be taken care of. It is very, very important. It is through the gate, the mouth, that we are able to express ourselves. I'm speaking through the mouth. If I also don't have teeth, probably I'll not be able to pronounce even the words we are pronouncing them. I will kind of like not be able to do that properly. So speech is also from the mouth and with the teeth and the tongue. So we need to take care of that. We also eat. The rest of the body actually benefits from the mouth because we eat, we chew the food and all that. So the body becomes healthy. If the mouth is not there, it's not taken care of, then the body also will become weak. So you start becoming sick. So the mouth is very, very important. In fact, we speak through the mouth. We bless people. Okay? Yeah, we speak good words. The preacher here using her mouth to express what she has in her mind and in her heart. So what we have in our heart, what we have in our mind, we also express it through the mouth. It is very important. In fact, I think somewhere Jesus said, out of the abundance of the heart, the mouth speaks. Yes. So if your heart is full, your heart is blessed, your life is blessed, then you use your mouth to bless other people. So you need to take care of our mouth. Okay, as a dentist, so that is what I do. I help people to have a smile. Because a smile is very, very important. Can I see people smiling? Hey. You can see, I'm seeing one person putting their hand over their mouth. Why are you putting your hand over your mouth? Can I see people smiling? Yes, show your teeth. Yeah, exactly. Good. Because you're happy, isn't it? Yes, when you're happy, you smile. Okay? And then when you smile and laugh, in fact, the other part of the verse says laughter is medicine to the bones. Exactly. If you don't smile, if you don't laugh, you're gloomy and you're smiling, you are whatever all the time, and you don't laugh, your bones also start weakening inside. So if you want your bones to be strong, you need to be smiling. And for you to smile and to laugh, you need to have nice teeth. You need to have nice teeth. Yes. Good. Yes. And if there's something not very right, that's why God has brought us there to help you to put it in a slightly better way. In our clinic, we say your smile is our concern. So that's what we do to make people get a smile. They already have a smile, but probably even make it a bit better. So now, where do I start? I think I'll start with, I'll just mention there are very many diseases that affect the mouth and the teeth. But there are two main diseases that affect the mouth and that affect the teeth. I think for our purposes today, I will just talk briefly about what we call dental caries and gum disease. What is dental caries? In a layman's language, people say cavities. Okay? I have a cavity on the tooth. So when you have a cavity on the tooth, that's a disease. It's called dental caries. What causes cavities in people's mouth? All of us, we have some bacteria in the mouth, some small doodles. In Kiswahili, we call what? Bacteria is called what? In Kiswahili? What is bacteria in? Tabitha. Tabitha is not here. Okay. There are some small, tiny. We don't even see them with our eyes. We can only see them with a microscope. They are there, and they help us. They are good bacteria. because they help us to remove some other funny things and all that. But if when we eat sugary food, like now we have eaten a cake, and it is not a sin or bad to eat a cake. When we eat sugary foods and we don't remove after we have eaten, then that sugar stays and that sticks on the teeth. If you don't brush, let's say today in the evening, and you've enjoyed your cake and all the nice things today, you don't brush tomorrow, the other day, that bacteria come and attach itself to that sugar, and it forms something called plaque. If that sugar now stays for a long time, and that bacteria, they produce some chemicals called acids. And those acids are now the ones that start destroying the tooth, the enamel of the tooth, the hard surface, the white thing, the white surface of the tooth. So they create what? They create cavities. So we have the bacteria. The bacteria are there, they are useful, they are normal. In fact, we call them normal flora. Okay? We call them normal flora. God created that bacteria. It is good, it's there in the mouth. It needs to be there even in the gut and in the stomach. It is called normal flora. But when sugar tilts that balance, we don't remove that sugar, the biscuits, the lollipops, the what, then you add a bit of time. It is not that you eat today and then you get cavities in the evening. No, it is like you eat and you stay for a long time and you are not removing that sugar from the mouth and that plaque from the teeth, then that's when you get some false cavities. And when that bacteria comes later on, when the cavity is very small, you don't feel pain. Later on, it goes deeper, you start feeling a little sensitive. You feel sensitive kidogo. Later on, that bacteria can go and it goes into the nerves inside. When it reaches the nerves, that's when you start feeling, I'm having some pain now. The tooth is aching. Now you start getting a toothache. If that is not taken care of, then that bacteria goes down and into the bone, and then it forms some infection. It gets an abscess. Have you seen somebody who is swollen? A swelling. So when they now get the swelling, now that's when there is infection now, not in the tooth, but now in the bone and in the gum. Now that one is serious, needs to go to the hospital, get antibiotics, medication, do some treatment, or end up removing the tooth. So that is basically what the dental caries is all about, or dental cavities. And as you see, as we go, what we should be doing, if you check number 2 there, we are not saying, I think it's Mrs. Njonjo who asked me, now we have eaten cake and now we are coming to talk about whatever. You see the word I'm using there? It's what? Limit. It's a limit, isn't it? We are not saying stop eating sweets, stop eating biscuits, stop eating cake all the time, but it is limited. So we cannot have a birthday today, in the evening, tomorrow we have another birthday, Tuesday a birthday, Wednesday, Thursday, Friday. By the end of the week, people will start having cavities. So we need to limit. So if it's a birthday now, then we wait for a longer time. Then the other disease we have, it is called gum disease. In a layman's language, or in a dental language, we call it periodontal disease. But in a layman's language, we call it gum disease. How does gum disease form? Gum disease now forms when you have food around the teeth, then the bacteria stick on that food. So if you don't brush that fresh food that you've eaten, after some few days or something, it forms a yellow coating on the tooth. You've seen a yellow coating? Some yellowish on the teeth. That yellowish is called plaque. It's called plaque. P-L-A-Q-U. That plaque, still you can remove it with your toothbrush. Okay? And it will come out. It's not very hard. It is not attached very strongly to the tooth. But if that plaque stays longer on the teeth, a few weeks, a few months, it now becomes something very thin that cannot come out with the toothbrush. And that hard stuff is what we call tartar. We call it tartar or calculus. Okay? It's the same word, but in a layman's language you call it tartar. In dental language you call it calculus. So it's very hard. Sometimes it can be greenish, it can be dark. And that tartar, the bacteria is also inside there. Those bacteria, they release some chemicals. They release some bad chemicals into the gum. So those bad chemicals now are released from the tartar into the gum, and they start destroying the gum. The gum responds by becoming swollen. So you check, you find like, hey, here my gum is swollen. Okay? You notice the gums starting becoming red. Or even if you are brushing your mouth and there is an area you don't brush well, after some time you notice that area is red. Later on, you can see when you are brushing, you find some bleeding or some redness. You can see the gum becoming red. You can even find when you are brushing, you are getting some bleeding from the gum. Okay? So if you find you are getting a little bleeding from the gum, that means you have not been brushing well. Either you need to brush, don't stop brushing. Some people, when they see bleeding, they stop brushing. They think, now, I think probably I'm brushing too hard. No, if you see some bleeding, then you know that you've not been brushing well. You actually need to brush even more. And after 2 days, that bleeding will go down. But if the tartar is there, that time you need to come to the dentist for the dentist to do a cleaning for the teeth. Then after the gums are destroyed, there is quite a bit of inside the gum is destroyed. Even a little pus can form inside the gum, and that's why sometimes you may feel like people don't have very good breath. Okay, so that is what causes bad breath in people when they bad breath can come from other things, from eating other things like probably garlic and other things. But for most people, the bad breath will come because there is a bit of a gum problem, and then that time you need to see a dentist so that they can clean your teeth and help you in the issue of the bad breath and show you how to brush your teeth, and the issue of the bad breath will go away. So now that, when it reaches there, it reaches even the bone. Those acids reach the bone, they start destroying the bone, the one that supports the teeth. And later on, after much bone is lost, you find the teeth are starting to do what? To shake. Yeah? You see like Shoshu, sometimes the teeth shaking. Yes, so that is gum disease, that is periodontal disease. The bone has been destroyed or damaged, so the teeth are now loose, and they can start falling out. So you find now the teeth are lost. So largely these two diseases, the good thing about it, these two diseases, dental caries and periodontal disease, are largely preventable. They are preventable what? Say preventable diseases.
Preventable diseases.
Preventable diseases. There are some diseases you can't prevent, isn't it? Yeah, you see like, now see like last year we had what? COVID. We could try, but sometimes we could not prevent it 100%, isn't it? Because you could touch something or greet somebody or something like that, or you are close to somebody, they sneeze and you get. Okay, we were trying, but it's not a very preventable disease. But these two, we can prevent by how we do what we do. Okay, what do we need to prevent dental caries? We need to go through this bright smile journey. And the first one, if you don't get anything from me today, number one, let's say together.
Brush your teeth twice a day.
Brush your teeth
Twice a day.
If you brush your teeth twice a day, you will probably be able to prevent 80% of the dental caries and of the gum disease. As when you were growing up, when you were young, we did not know about brushing our teeth. And in fact, sometimes we only used a small swab. We didn't have toothpaste when we were growing up. And we did, because nobody told us about dental caries, so our teeth, the older people, our teeth ended up getting destroyed. So we only came to know about it when we were grown and all that. But now you people, we are teaching you so that you can start early. Even when I went to high school, I think I got my first toothbrush, ya duka, nikiwa standard 7. Yes, when I was in standard 7, that's when I got my first toothbrush. But today I'm giving you, we are going to give you, everybody here, even the 6-year-old, a toothbrush, okay, and a toothpaste. So you have no excuse. You are starting early. As when you were young, even in high school, And even today, many people when they're in high school, and I don't know what happens here, many people only brush their teeth in the morning. I want by a show of hand, how many people here brush twice a day? Twice a day? Not all the time. Who brushes twice a day, every day? The children here?
No.
You see, you are like us probably. I think we have not been doing a very good job, but that's why we have come today, so that we can change that story. We can change that narrative. How many brush once a day, every day? Show me by your hand. You brush once a day, every day. You see, about probably 80%. There are still some who brush once a day, but not every day. Not every day. So today, today, what is the date today? 29th of May, 2021. 2022. Tumaini Children's Home are going to start brushing their teeth
Twice a day.
Without fail. Is that okay?
Yes.
And then when you do that, you don't have a need to come and see Dr. Mwangi and pay a lot of money to fix your cavities or to remove your teeth, which is painful and that kind of thing. You still need to come so that I can check and see whether there is something not very right. But if you do that, you are preventing most of that. Limit sugary
Snacks.
Limit sugary snacks. We are not saying absolutely that you can never eat a sweet or a cake. We even brought a cake with us. But we limit. You don't eat at every shilling you get lollipop. Every 10 shilling you get, what do you call it? The bigger one is called what? Jawbreakers. Yes. And you are even breaking your jaw and eating them. And we are breaking your jaws, eh? Okay. Not every 20 bob you get, you buy jawbreakers. She's laughing, probably she has never heard about it. Okay, so we limit, yeah? Please just let's replace that by eat healthy foods. Healthy foods are like what? Yes, carrots, vegetables, sugar cane, body building foods, yes. Fruits, yes. Fruits, yes. Broccoli, yes, I love broccoli. Wow, what else? Strawberries, yes. Healthy foods. Banana is very nice. I eat a banana. Oh, even today I ate a banana before I came. Yes, even poo is very nice. Yes, so those are the foods now we need to start eating early. Yes, even porridge is good. Yes. Instead of juice, okay? Instead of juice, better to take porridge. Better to take also water. You take a lot of water. Yeah? So eat healthy foods. So when you get a little money and all that, we try buy a fruit. As you are walking around, instead of buying a sweet, buy a banana, an orange, a mango, an avocado, or something like that. We learn to eat healthy foods and cut down. And then we say visit the dentist. Yes. You don't have to visit the dentist because you are in pain, but we normally say visit the dentist at least once a year. Because there is a cavity somewhere you may not be able to see. And if I get it, or we get it when it is very early, we can put a small filling, help you do your cleaning your teeth, and then it doesn't become very big and you don't go into pain. Okay? Yes. So now I want to demonstrate how to brush your teeth. Because sometimes we are told brush your teeth, but we put the toothpaste and then we do like quickly, 30 seconds, and you're out. Another study that was done in the UK showed that on average, people brush their teeth 31 seconds. Okay? But you're supposed to brush a little longer. If you brush properly, it should be about 2 minutes. If you put a clock timer there, if you brush properly, the whole mouth, 2 minutes should be the minimum that you should be brushing, not 31 seconds. Okay? Yes, I can see when there are those probably. We are also there, we are guilty of that. 30 seconds. Okay. 30 seconds, you only brush the front ones. You've not brushed many parts of the body. Okay, of the mouth. Okay, here we go. One, when you brush your teeth, you need to use a soft or a medium toothbrush when you're buying the toothbrushes. Okay? In fact, when I was buying, of course, I wanted to buy soft, but I couldn't get soft. But this is written up here on the package. It's either written soft, medium, or hard. So when you're buying a toothbrush, please check on the package that you ensure you buy. Usually we advise you buy soft. If you don't get soft, then you can take medium. But don't buy a hard toothbrush, because the hard toothbrush damages and destroys the gum. Is that okay? Then don't share your toothbrush with anybody. Is that okay?
Yes.
You have to use your own toothbrush, because you don't want to get the bacteria in somebody's toothbrush and take them to your mouth. Yes, let their toothbrush remain theirs, because then their bacteria will not harm them, but their bacteria might harm you. So only don't use your own toothbrush. Don't share. Don't borrow toothbrushes amongst yourself. The other thing is, when you use a toothpaste, how much toothpaste do you use? Sometimes we get like this. I'm sure Rose will be very happy about this. You get the toothpaste and you put from here to the end. That way, you are not able to brush your teeth properly if you put too much toothpaste. Because immediately you start brushing, you produce a lot of foam. And within 30 seconds, you want to start rinsing your mouth, so you don't end up brushing your teeth. So when you get the toothpaste, you put a very small, tiny amount of toothpaste on the toothbrush. We normally say the size of a pea. You know the pea? Pea inaitwa nini? Minji. You know minji? Yes, minji ama njoho. That size of minji, that is the toothpaste you should use. Don't fill the whole toothpaste. And that way, even your toothpaste is going to last and take a long time. A tube like this should take you a month or even more when you are putting just a small amount, morning and evening. This one should last for more than a month. Is that okay? Then you don't even have to spend a lot of money on toothpaste. Let's brush our teeth. You have put the small toothpaste here, probably just a bit of water to make it a bit wet. Then you start. Every time you're brushing, please, we start at one point in the mouth. We normally recommend you start on the lower left. If you are right-handed like me, you start right here. Okay? Mm-hmm. If you are left-handed, you will start on the other side. But because I'm right-handed, I start from here. And because the gum goes like that, like forming like U's, yeah? Mm-hmm. If you brush across like this, there is a small part at the bottom which is left unbrushed. That part of the U, isn't it? Mm. The bottom of the U. Mm. The gum looks like that, and the tooth is there. Yeah? So if you brush across like this, if you brush across this part, it's left unbrushed. Today, tomorrow, and that's how many people get the gum disease, because they don't brush this part. So when you're brushing, we recommend you brush in a circular motion. You go in a circular motion, small circular motion. You almost each tooth or two teeth at a time. You are not rushing. You're going gently, circular, coming to the front. Go circular. You're not rushing. Going all the way circular. Turn your toothbrush the other way, all the way to the end. Then have reached the end of the lower side. I'm not going to the top. I am going to the bottom, on the inside, the side of the tongue. Okay? The side of the tongue, it may be difficult to go circular because of the tongue. So ideally here, you might have to brush back and forth, or do like that. The front here, you should go up and down at the front. Then again, all the way to the back. Then remember to brush the biting surfaces. You see where there are deep grooves, yeah? Deep natural grooves where food stick, yeah? Now you need to brush those grooves so that you remove the sticky food. Like now the cake, if you eat a biscuit or something, they stick there. Or if you eat chukaranga or something, they stick down there. So you need to remove that. Okay, so you see that? That's about you taken a minute or more, isn't it? To come like this, circular, go to the inside, then the biting services. Then from there, we go to the top. These back teeth here, if you open your mouth wide, you will feel your toothbrush does not go to the end. Is that okay? So for you to brush the last two teeth properly, because when you open, the teeth goes closer to the bone, and so there is no space. So for you to brush your teeth properly here at the end, you close your mouth a bit. Is that okay? You close your mouth just a little bit. You will, don't bring your teeth all the way together, but you will feel your toothbrush has gone all the way to the different people. So it's you to tell how much to close and open, yeah? So, but try to close and you'll feel your toothbrush getting all the way to the last two. Then again, in a circular motion. As you come to the front, open a little. As you get to the back, on the top, close your teeth again. Then brush all the way to the end. Open wide now to be able to brush the inside of the upper teeth, so that you keep the tongue away, because the tongue prevents you from brushing there. It starts kicking you out. So for the tongue, to keep the tongue away, open wide, brush again, all the way, brush the biting surface, and then after you finish the teeth, brush your teeth, brush your tongue. Just touch your tongue with the same toothbrush. At least the tongue, you can do it just once in the morning, so that you get a bit of fresh, you get good breath in the mouth. Because the tongue has a lot of food and plaque and a lot of bacteria. So you also just scrub your tongue just a little, not too much, just a little like that, then you rinse your mouth. Okay?
Yes.
Are we there?
Yes.
Brushing twice a day, remitting sugary snacks, eating healthy foods, visiting the dentist when you can. Is that okay?
Yes.
Yes. Because you're not even going to be in Tumaini for very long. Very soon you will be out of here and working out there and having your own money. So when you have your own money and you are out there, you need to visit there. You need to visit the dentist, wherever you will be. Some of you will be here in Kenya. I see some of you will be in Australia. Others, I'll find you in London.
Amen.
Yes. But I want to find beautiful teeth. So when you see me, please say hi to me. Eh?
Yes.
When we meet in London, please remember to say hi to me. Usinisahau mukienda juu, usinisahau kwa sababu Mungu anawapeleka mbali.
Amen.
Sawa? Pardon? You need to start going to the dentist so that they can clean you. Yeah, they can clean your teeth. Yes, that's what your mommy said. Yeah, mommies are always light most of the time. All the time. Okay. So I don't know. I will leave these ones forever, Los. I've already taken the whatever to put a few. I was told this is the dining hall, so probably. So there's a few messages on I just printed from my computer on some of the messages. So once you are eating, you can remind yourself some of the things we have said. But please go ahead and implement that. Can I take one or two questions?
Yes.
Yes.
Can we brush the lips?
Can we brush the lips?
Yes.
By the way, you can also brush your lips. If you touch your lips with your toothbrush, it kind of like massages the lip, and you actually feel a tingling sensation on the lips. So it is actually quite in order, not probably too hard. You have to be very, very gentle, but you can actually touch the lips just a bit. Yes, it's good. Yeah. Another question?
You were once told that the advisable toothbrush to be used is the one that has rough surface at the back.
The rough surface at the back.
Yes.
Oh.
Yes.
Yes, exactly. You see, like the way they make them. Like now you can see this has a rough surface. Because the rough surface, as you're brushing your teeth, you're probably also touching the the cheek, okay? And it is doing an effect on the, it is kind of like rubbing on the lips, on the inside. So it is also doing that kind of like massaging and on the lips and on the cheek of the inside. And so they have done all that research, and that's why you find like this one. Naturally, they have already put a laughness on the inside. Yes, at the back of it. So they already do that for you. Yeah. So almost all the toothbrushes these days, from research, they already have that. You may not even know about it, but it is already there. Yes. Daktari, you wanted to ask something? Or Rose?
I wanted to ask on my daughter's behalf.
Yes.
How can I brush her? Because sometimes she bites the brush, nakuta hiyo nini, the floss.
Yes.
Yeah, so it becomes difficult.
That is the beginning point, and that's why you have to use very little toothpaste so that even if they end up swallowing, and then for the small children, you find that you have toothpaste which is normally written the ages of the children that you should use. 0 to age 2, age 2 to age 4 or 5, then age 3 to age 7. So you should use, specifically you need to use that particular toothpaste. But then the thing is that use a very tiny, for that child, not even the pea size, literally just to, so that, and then try to brush them, but also let them brush themselves. Let them chew the toothbrush you'll be buying every week, but don't insist on forcing them. Please take your own toothbrush, let them also take their own toothbrush. So as you're brushing, you tell them, let's brush our teeth. So you are demonstrating, can we brush the front teeth? You are brushing yours, therefore children like imitating. And if you let them imitate you, then you'll not have a big trouble. But if you try to force them to brush their teeth, and you are not brushing yours, you'll have to tell me, why are you brushing my teeth and you are not doing yours? So brush together. You can even brush the whole family at the same time, so that everybody can see everybody is doing it, so then it is good for all of us. Yeah. Okay, close.
Is it okay to eat the toothpaste?
To eat our
Is it okay
toothpaste?
to eat toothpaste?
No, toothpaste, this toothpaste, most of the toothpaste that we have, it contains something called fluoride. Is that okay? High amount of fluoride to strengthen our teeth. But that fluoride and other chemicals that are in the toothpaste are not good for the body. So it will not kill you, but it is not healthy for our bodies. It is going to go to the bones, that fluoride is going to the bones and make your bones weak. It's going to go to other parts of the body and change the equilibrium and whatever of the fluids in the body. So please don't eat your toothpaste. Yes, it is not healthy, it is not good, and it is not safe for you to eat your toothpaste. And that's why we are putting very little, so that our chance, because nobody will prevent 100% swallowing kidogo, sindio?
Yes.
So that even if you ended up swallowing kidogo, it doesn't harm us. And that's why we advise, please use very little. But if you use too much, you will end up even swallowing. But even taking the toothpaste and putting it and eating it, that one is a no. Is that okay? Yes. We shouldn't do that. That's also like throwing away money, isn't it? Yes. Eating toothpaste is like taking the money and throwing it in the sink or something like that, because you didn't use it for the proper use. So we should be good stewards of what God has given us. So we should be good stewards of toothpaste and all the things that we have in the school and in the home. Yes.
How long should we use our brushes? Because sometimes we find we realize we need a new brush after almost 1 year.
Yes. We should change our toothbrushes. Ideally, when you start seeing the toothbrush, when you start seeing the bristles are bending like this, if the bristles are bending like this and you are brushing here, do you think they are facing like this? Do you think they are doing a good job? No, they will not do a good job if they are facing like this. So the bristles should be flat, should be straight. So sometimes after 2 months, 3 months, but I don't think any toothbrush can go past 5-6 months. So 5-6 months, you should change and have a new toothbrush at most. But if you are able to, about 2 to 3 months is a good time to change the toothbrush. Yes.
of, I'm also asking on behalf of, how do we store our toothbrushes?
How do we store our toothbrushes?
Yeah. And do we ever put them in water or something like that?
No, the toothbrush, after you brush your teeth and you have washed the toothbrush, it should be allowed to dry. Okay? It should not be left soaked in water, because that helps that bacteria to even grow, flourish, and all that. But if you leave it, let's say, in a grass or somewhere to dry, even in your box or somewhere, and leave it to dry, the bacteria which was left on the toothbrush also dies. So that by the time you come to brush next time, it doesn't have live bacteria. Is that okay? So please let your toothbrush, and also you can heat something like this, either the steam, to remove excess water, so that then you keep it so that by the time you brush in the evening, it is dry. So it should not be soaked in water. Very good. Yes, ma'am.
Yes, for how long should you stay after brushing your teeth before eating?
Before eating?
Yeah.
Okay. One, I said you brush how many times a day? Twice a day. The most important time to brush is not in the morning. The most important time to brush is in the evening. Why? Because you have spent the whole day eating, so there is a lot of food and plaque in your mouth. So if you don't brush your teeth at night, the bacteria use all that food you have eaten in the day to start making cavities and gum disease. So the most important time to brush is at night, because when you sleep, you are not moving your lips. So the bacteria, they are dancing. If you didn't brush at night, they are happy, having a field day, trying to do damage all your teeth at night. So you brush at night. So you see, after night, you brush, you don't eat. After that, you go to sleep, isn't it? Yes. In the morning, why we also brush our teeth is that initially, ideally, we should either brush before, after breakfast, but there are some people who will also brush before breakfast. In the morning, it is more because the mouth is not fresh. Okay? You want a lot of thick film, some thick film accumulate saliva on the teeth and it hardens. So in the morning, we need to remove that plaque, and so that the teeth are healthy. But you realize that in the morning, you start eating, you take breakfast, or by 10 o'clock, you've already started eating. So that means your mouth was only clean for about an hour or 2 hours. And that's why at night, people who brush only in the morning is almost equivalent to no brushing. Because their mouth is only clean for about an hour or two. They've started eating. But then the next 20 hours, the mouth is not clean. So they're more important to brush at night. Because if you consider the 2 hours the mouth was clean in the morning, plus another 8 hours of sleep, that comes to 10 hours or 12 hours. So that means half of the time the mouth was clean. But for somebody who brushes only in the morning, their mouth is only clean for an hour or 2 hours out of 24. So that's why we normally say, if you only brush in the morning alone, it's probably almost equivalent to no brushing. Yes, so we need to brush morning and night. So,
I'm wondering why we have the toothpaste and also the mouthwashes.
Yes, the mouthwashes.
Yes.
Yes.
I mean those liquids, the Listerine and all.
And all that. Yes.
Why do you need to gargle?
Yes.
After you have brushed your teeth, or you can just gargle?
Yes. Okay. The toothpaste. The most important thing is the toothbrush, not the toothpaste. In fact, even if you don't have the toothpaste and you brush it alone with a dry toothbrush, it is still okay. If you finish your toothpaste, don't worry. Go ahead, take your toothbrush, go to the sink and still brush. It will remove probably 95% of the bacteria. But the toothpaste helps to kind of like form a film and make you also feel nice because it's tasty and encourage you to brush. And that's why we have so many toothpaste. So I don't care, and I don't care which toothpaste you use. And that's why I came with many of them, different types, so people can taste whichever. But you try to use the toothpaste, your taste buds feel it's good. Because if you like it with your taste buds, you will stay a little longer. If you use a very harsh toothpaste, you will want to come out quickly. And that's why toothpaste like Sensodyne, they used to be very tough those days. but now they are starting to make them a little better because they realize that people don't linger with them for long. The mouthwash, it's good to use it, but it is not really a must, especially for the older people. Then they probably need because there are some places the toothbrush is not able to reach. So the mouthwash, it goes into those places and kind of like helps to kill a bit of the bacteria, especially in between the teeth. And something that I forgot on brushing, we should brush our teeth, but here probably it might not be practical for the children, but for those who are able to do that, to afford it, we always say we should floss our teeth. Floss is using a small string that we get from the supermarket and remove the food in between the teeth. It helps to remove the food in between the teeth. So we brush and floss for those people who are able to get a dental floss. So that's what I would say. So that for children, they don't need a mouthwash. No, they don't need a mouthwash for children unless it's prescribed by the doctor, they have a sore throat or something. But on a routine basis, they don't need a mouthwash. Even for adults, it is not important to use a mouthwash every day. You can actually use like 3 times a week or something like that. Yeah, we shouldn't use chemicals because we have a lot of alcohol, a lot of very strong chemicals, which are still not very good for the mucosa of the mouth. And they also suppress the bacteria, the normal bacteria. They tend to overkill the bacteria. So ideally, I don't recommend using at a morning, evening, unless there is a reason to do that at that particular time with a prescription from the doctor. So that means a bottle of mouthwash should last there for 2 months or so in the bathroom. Yes. We are good. We are hungry now. We need to go and eat. Yeah? Did you like the talk?
Yes.
Have you learned something?
Yes.
Very good. I'm also happy at least to share a bit of the knowledge that God has given us. So, I had talked to Rose. These toothbrushes are packed in threes. When they pack them in threes, it's slightly more affordable because there's the cost of the packaging. So when they pack them in 3, then they make them slightly more affordable than packing one. So these days they are now packing so that it's a family, they can buy 1 packet, but they have different colors. Like this is purple, blue, and green. So what we are going, Rose, how do we go about that?
You can just distribute 3 of them, they share.
3 of them they share.
Yeah.
And they can open now and
Yes, they can.
and everybody takes theirs.
Yes.
Oh, good. So where do we start?
Yeah.